Course do matter, they don't define you. Consistently, all the years of MBBS matters. The first year specifically is vital as it sorts out the early stage troubles in contemplating acquaintance with new specialized terms, tests the essentials, and empowers in building up a solid comprehension of the rudiments. Accordingly, the first year could make you tedious or even scare if you do to the new subjects and ideas. Despite the fact that dreading this time is a characteristic nature, your seniors have also crossed it in a similar boat you are in now, and clearer image of the primary year could help you plan your investigating timings. Here is an easy guide for you to travel the boat in a simple, easier and a quicker way. Ideally, a MBBS student go through 6 hours per day for concentration in the first year to pro the test. There are absolutely 5 subjects, yet the measure of time to be committed per subject relies upon your capability of or information in each. The ability to focus on an individual could be less. This implies you can't take too long to even consider contemplating ordinary and trugged. So keep your planning time fresh. Despite the fact that 6 hours is required, partition them appropriately so you can center during your investigation hours. Tips for getting distinctions in first year subjects, or how to study your first year subject to score good marks. Like I scored 559 in my first professional exam, so I can share some tips with you to how to study the subjects biochemistry, physiology and anatomy in your first professional MBBS. I would be talking about biochemistry. Study daily with the marrow plan or the prep ladder or any plan which you are having, and refer to the notes given by the coaching institute. Every metabolic cycle should be learned with every enzyme involved. Draw as many cycles as you can. Ace in practicals as they carry equal weightage. Hard work and full dedication towards the subject is the key. Solve whole last 10 years question papers. And for physiology, study daily with your coaching institute and refer to their notes. Make your own flowcharts and draw as many as possible in your theory exams. Flowcharts are nicely given in the notes of your coaching institute. Ace in practicals as they carry equal weightage. Hard work and full dedication towards the subject. Solve whole 10 years question paper. And now for anatomy, the most dreadful or the most feared subject, but I don't think that it is fearful. I loved anatomy as its concepts are they make you to go through your body parts. So yeah, I like the anatomy subject. Anatomy, study daily with your coaching institute notes and the video lectures. Get your concepts clear. Practice and draw as many diagrams as you can in the exams. Diagrams should be properly labeled and colored. Use your online platforms videos to get oriented with the topic. Refer to anatomy atlas every now and then. Ace in practicals as they carry equal weightage. Hard work and full dedication towards the subject. Solve whole 10 years question paper. Time management. The most effective method to study is to allocate time proper for each subject. Basically, human mind has less capacity to focus, so partition your concentration into an assortment of modes. It is not difficult to make arrangements. The hardest piece of making arrangements is adhering to them. Be that as it may, what an arrangement empowers you to do truly is make a propensity for determination. Calculating 6 hours daily is certainly not a fantastic undertaking. Yet, don't beat yourself a lot of the timing. It's okay to be negligible a few days when troubles arise. Additionally, it is a great idea to have high targets so you can consistently continue running after accomplishing more. Be that as it may, attempt to be practical. For example, on the off chance that it requires 2 hours of you to examine one piece of a subject, don't set your objective planning to 30 minutes. You can begin with 1 hour 30 minutes and wind up completing a decent measure of bits in 2 hours. So work on timing bit by bit as opposed to setting over ambitious targets and winding up not adhering to them. Scores do not matter. Scores do matter, though they do not define you. Scores do matter, they don't define you. Students, as MBBS is concerned, achievements isn't characterized by the imprints you score, since you will be assessed on different factors. So focusing on a differentiated isn't about a significant as completely understanding and appreciating the subject. Put taking all things together, your center, enthusiasm and energy towards medication, yet don't have elevated standard concerning marks. Give a valiant efforts and leave the rest. A fruitful MBBS student is one who has a profound comprehension of the ideas in the prospect sufficiently adequate to treat patients in the wake of securing the degree. So do as best as you can and keep studying. Thank you.